The most common complaint of patients with hip problems is groin pain, often associated with stiffness. Sometimes patients describe the pain as radiating down the anterior thigh to the knee. Some other patients will complain of posterior buttock or lateral hip pain, but a vast majority of patients with hip problems report groin pain on the affected side. Over time, a limp may also develop. Some actions that bother patients with hip problems include prolonged walking or standing, trying to get up after prolonged sitting. Often patients with hip problems will report problems with certain activities like dip bending, squatting, navigating stairs, tying shoes, or putting on socks. The hip joint is a ball and socket joint. Arthritis is defined by wearing away of cartilage, which is the cushion of the joint. Total hip replacement involves making an incision on either the front or side of the hip and getting down to the hip joint to remove the damaged ball and socket. Once the damaged parts are removed or shaved off, they are then replaced with a combination of metal, plastic, and ceramic implants to restore the function of the joint. A good candidate for hip replacement surgery should have documented debilitating hip arthritis that is significantly affecting his or her daily activities. Oftentimes, the patient's symptoms have stopped responding to non-operative treatment. Once a patient is deemed a candidate for surgery, he or she should be in good enough health to withstand surgery and the required postoperative rehabilitation. The Johns Hopkins team is multidisciplinary. It includes nurses, operative room technicians, medical doctors, rehabilitation doctors, anesthesia doctors and nurses, physician assistants, nursing practitioners, and obviously the surgeons. The procedure takes approximately 1 to 2 hours, and the patient stays in the hospital for 1 to 2 nights before going home. More recently, we now offer outpatient total joint replacements where selected patients are able to come in for their surgeries and go home on the same day. The time to full recovery is different from patient to patient. However, on average, most patients with sedentary jobs can return to work within 3 to 6 weeks. Patients with labor-intensive jobs usually will need about 6 to 12 weeks before returning to work. Complete recovery can sometimes take up to 6 to 12 months, depending on the patient's overall health. In the past, doctors reserved hip replacement surgery primarily for people over 60 years of age. The thinking was that older people are less active and therefore expected to put less stress on an artificial hip than younger people. However, in more recent years, doctors have found that hip replacement surgery can be very successful even in the younger population. New technology has improved the prosthetic parts, allowing them to withstand more stress and last longer. Today, a person's overall health and activity levels are more important than age in predicting the success of hip replacement surgery. All surgeries are associated with some risks. Complications after total hip replacements may include infection, excessive bleeding, blood clots, hip dislocation, fractures, limb length inequality, and damage to blood vessels or nerves. It is important to note that these complications are relatively rare because advances in technology and surgical techniques have greatly reduced these risks. Patients can expect dramatic pain relief and overall improvements in function, range of motion, and quality of life. Recent advances in pain management has allowed us to control our patients' pain significantly, even starting from the day after surgery. Yes, most patients will need at least 3 to 6 weeks of formal outpatient physical therapy but most are still encouraged to continue home exercises even after completing formal physical therapy. Before considering surgery, the doctor may offer physical therapy to strengthen the hip or the use of assistive devices like a cane or crutches to offload the joint, or even the use of medications like anti-inflammatory medications to help with pain and inflammation control.